Infection control in hospital dentistry. Infection control, also called as exposure control plan by OSHA, is a required office program that is designed to protect personnel against risk of exposure to infection. Sterilization is the use of a physical or chemical procedure to destroy all microorganisms, including substantial numbers of resistant bacteria. Disinfection is the destruction of pathogenic and other kinds of microorganisms by physical or chemical means. There are six links in chain of transmission of infection. These are the infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Now, this can be transmitted through direct contact with blood or bodily fluids, indirect contact with a contaminated instrument or surface, contact of mucosa of the eyes, nose, or mouth with droplets or spatter, and inhalation of airborne microorganisms. What is infection control in dental practice? All dental professionals are expected to meet stringent standards of infection control and are responsible for ensuring that dental instruments are safely disposed of or cleaned and sterilized so they are safe to reuse. Why, who, and what? Why is infection control necessary in dentistry? Dental staff and patient may be exposed to a wide variety of pathogenic microorganisms. Who is responsible for infection control in the dental office? Each member of the dental team must follow the recommended guidelines. What should be done to prevent the transmission of disease in the dental office? These are the most effective ways to prevent the transmission of disease includes hand washing, gloves, face mask, protective eyewear, protective clothing, and instrument sterilization and disinfection. Disease transmission in dental office. Dental office should have an infection control program to prevent the transmission of disease from the following: patient to dental team to patient to patient, dental office to community, including the dental team's family, and community to dental office to patient. These guidelines should be followed each time treatment is performed. Immunization, patient screening, hand washing, barrier technique including personal protective equipment, rubber dam, and pre-procedural rinsing, needle and sharp instrument safety, instrument sterilization and disinfection, surface disinfection, radiographic asepsis, laboratory asepsis, and infectious dental waste management and disposal.
So why is it important? Infection control is vital to the safe, effective treatment of patients in the dental office. Proper dental instrument sterilization procedures aren't just good policy. They can help prevent diseases and even death. So there are 5 reasons why infection control is so important. First is we have dental instrument sterilization, which prevents bacterial growth. As we all know, bacteria are among the fastest growing organisms in the world. And when they carry disease, the results can be deadly. But proper sterilization techniques in the dental office can stop them in their tracks. Frequently, disinfecting dental assistant tools and equipment kills bacteria. So next is we have dental infection control prevents spread of disease. The bacteria associated with periodontal disease can be spread through saliva. There are also other diseases that can be far more concerning, such as tuberculosis, hepatitis, and HIV. Those bacteria can carry a host of diseases. Third is stop bacteria and disease in the dental office to prevent death. Healthcare-associated infections are among the leading causes of death in the US, but they are easily preventable with proper infection control in medical and dental offices. Bacteria often carry disease, which leads to that disease can cause illness and death. So fourth, protect dental staff with dental instrument sterilization. The prevention of patient-to-patient transfer of bacteria and disease is a top priority of dental professionals. It's also important to protect the dentist, dental assistants, hygienists, and other staff. So fifth, infection control maintains the reputation of your dental practice. One small mistake in infection control could have obvious health consequences. If word gets out that your practice doesn't follow proper procedures and puts patient in jeopardy, it could cost you your good reputation. So we have here the administrative measures. We have the key administrative recommendations for dental settings. So these policies and procedures should be tailored to the dental setting and reassessed on a regular basis or according to state or federal requirements. Development should take into consideration the types of services provided by the DHCP and the patient population served, extending beyond the Occupational Safety and Health Administration blood-borne pathogen standard to address patient safety. The infection prevention coordinator should ensure that equipment and supplies such as hand hygiene products, safer devices to reduce percutaneous injuries, and personal protective equipment are available and should maintain communication with all staff members to address specific issues or concerns related to infection prevention. And in addition, all dental settings should have policies and protocols for early detection and management of potentially infectious persons at initial points of patient encounter. We also have infection and prevention education and training. So the ongoing education and training of DHCP are critical for ensuring that infection prevention policies and procedures are understood and followed. Education on the basic principles and practices for preventing the spread of infections should be provided to all DHCP. Training should include DHCP safety such as OSHA bloodborne pathogens training and patient safety such as emphasizing job or task specific needs. Education and training should be provided during orientation to the setting when new tasks or procedures are introduced and at minimum annually. Training records should be maintained according to state and federal requirements. Steps for dental assistants to control infections in dental office. There are some standard practices to ensure that your practice, your patients, your staff, and you are safe. First is get vaccinated. The CDC recommends that healthcare workers get vaccinated for hepatitis B, flu, measles, mumps, rubella, chickenpox, tetanus, diphtheria, and pertussis. Next is perform proper hand washing in dental office. Make sure that every staff member follows strict hand washing protocol before and after every patient. Next is sterilize all instruments. Make certain proper procedures are followed to sterilize dental instruments such as chisel, cleaning scoops, scrapers, tweezers, and other materials after each use. Next is protect dental work surface. Perform frequent decontamination of countertops and surfaces with effective disinfectants and germicides. Next is use protective attire, such as gloves, masks, protective eyewear, and clothing are among the proper attire to use while working with patients. Additionally, you need to be sure to change gloves from patient to patient. Next is take accurate medical histories of patients. So how are you going to know with which patients you need to take added precautions if you don't know what medical issues they may have? Make certain to get complete medical histories and ask about specific diseases such as hepatitis, recurrent illness, infections, oral soft tissue lesions, and any diseases affecting the lymph system or the lymphatic system. We also have the key recommendations of hand hygiene in dental setting. because dental hygiene is the most important measure to prevent the spread of infections among the patient and DHCP. Education and training programs should thoroughly address indications and techniques for hand hygiene practices before performing routine and oral surgical procedures. For routine dental examinations and non-surgical procedures, use water and plain soap or hand washing or antimicrobial soap or hand antisepsis specific for healthcare setting or use an alcohol-based hand rub. Although alcohol-based hand rubs are effective for hand hygiene in healthcare settings, soap and water until the patient is no longer infectious or referral to dental setting with appropriate infection prevention precautions when urgent dental treatment is needed. Should be used when hands are visibly soiled, examples such as dirt, blood, body fluids, and for surgical procedures, one perform a surgical hand scrub before putting on sterile surgeon's gloves. For all types of hand hygiene products, follow the product manufacturer's table for instructions. Complete guidance on how and when hand hygiene should be performed. Key recommendations for personal protective equipment or PPE in dental settings. So personal protective equipment or PPE refers to wearable equipment that is designed to protect DHCP from exposure to or contact with infectious agents. PPE that is appropriate for various types of patient interactions and effectively covers personal clothing and skin likely to be soiled with blood, saliva, or other potentially infectious materials should be available. This includes gloves, face masks, protective eyewear, face shields, and protective clothing such as reusable or disposable gowns, jacket, and laboratory coat. Example of appropriate use of PPE for adherence and standard precautions include the use of gloves in situations involving possible contact with blood or bloody fluids, mucous membranes, and non-intact skin such as exposed skin that is chapped, abraded, or with dermatitis or OPIM. The use of protective clothing is to protect skin and clothing during procedures or activities where contact with blood or bloody fluids and anticipated. Use of mouth, nose, and eye protection during procedures that are likely to generate splashes or sprays of blood or other bloody fluids. DHCP should be trained to select and put on appropriate PPE and remove PPE so that the chance for skin or clothing contamination is reduced. Hand hygiene is always the final step after removing the disposing of PPE. Trainings should also stress preventing further spread of contamination while wearing PPE by keeping hands away from face, limiting surfaces touched, removing PPE when leaving work areas, and performing hand hygiene. And lastly, we have the key recommendations for respiratory hygiene or cough etiquette in dental settings. Respiratory hygiene or cough etiquette infection prevention measures are designed to limit the transmission of respiratory pathogens spread by droplets or airborne routes. These strategies target primarily patients and individuals accompanying patients to the dental setting who might have undiagnosed transmissible respiratory infections, but also apply to anyone, including DHCP, with signs of illness including cough, congestion, runny nose, or increased production of respiratory secretions. DHCP should be educated on preventing the spread of respiratory pathogens when in contact with symptomatic persons. And that is the end of our report. Thank you for listening.